If you don't like your provider, if they've made you feel some kind of way, go find another one. You're not going to get the perfect provider that matches you unless you kind of shop around, because there are going to be people you feel more comfortable with, or that take the time, or whatever that looks like. But
Yeah. Well, it reminds me of what your colleague from the VA said last week of
Yeah.
just, and her and her husband were, just sharing. It's like in any profession, there's the good ones and the bad ones.
Yeah.
And my experience too has been coordinating, and I've shared this with you, working with nurse practitioners. I've always had a lot more luck with my clients and some of my more complex clients where it's comorbid substance use and bipolar disorders, and I do a lot of work in that realm, coordinating with nurse practitioners as opposed to even psychiatrists sometimes, who have a little bit, like you were touching on earlier, maybe more of a range of things they can prescribe, but the nurse practitioners have always just taken the time. They've taken the time, and my clients always appreciate it. And especially with like bipolar diagnoses, where it's like the biggest hurdle in the beginning is like, I don't have to take my meds. It's like, wait.
Yeah.
Let's all get in this office and talk about why it's so
Yeah.
important.
Yeah.
But I hear that from what you're sharing, just like taking the time, listening to what they have to share. And I think a lot of people come into support, and this is what I've seen over there, and maybe you've heard of it too, is like, well, I'm going to be able to talk through all my stuff with the therapist, not the medical team. And it's like, well, maybe you're talking to the wrong medical team,
And I will say, I'm biased. I'm a nurse practitioner, obviously. Many of my own providers, as a patient, have been nurse practitioners. I feel like, and I'm not downplaying any other profession, I feel like we really have the time, we take the time to really kind of have that extra connection. And we come at it with kind of this holistic approach where we're looking at the whole patient, and it's not, medication is indicated in many cases, but there's so many other parts to your health than just medications. Whether that's, I'll tell my patients, you will need to go outside for 30 minutes every day, and I'll write it down and hand it on a piece of paper so that they have that, or whatever that may be.